In this video, I want to just introduce two-point discrimination and how that is done. In this video, we're going to be looking at static two-point discrimination. Your patient is positioned as they are for the Sims-Weinstein monofilament test, but we'll be using a different tool for this one. And make sure you can get stuck in there pretty good. All right. So they're positioned to palm up with the fingers and the thumb embedded in some therapy to keep them from moving. For static and moving two-point discrimination, but today we're just talking about static two-point discrimination. The tool you use is called a discriminator, and it has a bunch of these little metal prongs sticking out. On one side there's just one, and then on all the other sides of this octagon there are two that stick out at various distances. So for example, these are 2 millimeters apart, 3 millimeters apart, 4 millimeters apart, 5 millimeters apart, and so on. There's also another disc that continues on 9, 10, 11, 12, 13, 14, 15 millimeters apart. What you're doing with this is a test not of sensory threshold like the Sims-Weinstein monofilaments are. They test what's the lowest input that you can feel. The two-point discrimination is a different thing. It tests not sensory threshold, but rather it tests innervation density. That is how many end organs per square centimeter are actively feeling. So what you're going to do with this one, and again, I would be sitting across from my patient with a barrier here, perhaps a file folder that I'm holding, and I would have them close their eyes. And you just test them either with, you touch their finger just until it blanches, not any harder than that, but just until it blanches, with either 1 point, in which case the patient should tell you that was 1, or 2 points, in which case the patient should tell you that was 2. All right? And the whole point of this is to figure out for each area that you're testing how close together can these 2 points get before the patient perceives them as only 1 point. All right? Anything 5 millimeters or closer is considered normal. If they have to have more than 5 millimeters distance, say 6 millimeters difference or 8 millimeters difference, that's considered abnormal. The test is started typically alternating between 5 millimeters and then the 1 point. And again, with this one, you want to mix it up. You don't want to get into a pattern where you're doing 1, then 2, then 1, then 2. You want to mix it up so that the pattern is more or less random, so that the patient can't really tell you what's coming next, whether it's 1 point or 2 point. They won't be able to predict that by finding some pattern in what you're doing. If you touch them with 2 points and they say, yep, I feel 2, then they have that level of innervation density discrimination, but it's not enough to just do it once and say they have it once. With two-point discrimination, they have to get it right at that distance 7 times out of 10 attempts. All right, so if I'm doing the 5 millimeter distance, I need to repeat this at least 10 times in the same place, but not all in a row, but at least 10 times in the same place, and you have to keep track of how many times they got it right, how many times they got it wrong, and they have to have at least 7 out of 10 in each area in order to say they can feel two-point discrimination at that distance. Typically you start with 5, and if they feel that, that's great, that's normal. If you really want to grade it a little more, you can go down and check the 4 or the 3. It's not required. Because if they have 5 or less, that's considered normal. If they can't get the 5, then you have to work your way up into the wider probes and see what they can get there. The 2 points are applied kind of longitudinally on one side or the other side so that you can test, again, each digital nerve separately.